So the first structure I need you to find on your patient is vertebral prominence. Vertebral prominence.
Okay, so go ahead and have a seat for me. I want you to take your chin down to your chest. I'm going to stand to the side of my patient and visualize his vertebral prominence. I'm going to locate it as there, and I'm going to passively move his head back into extension. I'm placing my if on the vertebra right above it. And I'm feeling for the vertebra to translocate away from my fingers, and the one underneath my index finger did translocate away. That tells me that's C6 because it's the last fully retractable vertebra in the cervical spine. And the one underneath my SIF is going to be C7, his vertebral prominence. So I've located the patient's VP as C7. Otherwise, if the vertebra wouldn't have moved away, the one underneath my if would have been C6 as his VP. Sorry, T1 as his VP.
Okay. Next, using a shortcut, palpate the right transverse process of T8.
Go ahead and go face down for me, Stu. I'm going to drape your gown.
So using the shortcut, palpate the right transverse process.
Go ahead and lay down. So what I'm going to do is use my hands here in a scissor stance next to the patient. I'm going to feel for the posterior border of the ribs, and I'm going to knife edge my way down to the top of the iliac crest. That's my shortcut for finding the dissection point. Across the middle is going to be L4. So there, I'm over and replace with my superior hand, so that's L4. And I'm going to replace with my inferior hand and start counting up from L4, L5, L5, like we said T8, right?
Yeah, using a shortcut, palpate the right transverse process of T8.
Okay, so I'm going to restart that one. I'm going to use the inferior border of so you can see to this border, going from the inferior border of the scapula and across to the middle, lying down. This should be about T6, and so from here I can count up, down T6, T7, T7, T8. So I found the T8 spinous process.
So right transverse process of T8.
So from there, I'm going to use my superior hand and move up 2 interspinous spaces. 1, 2, lateral an inch, moving soft tissue space away. And then I'm going to come over, bring my external occipital midline, using just my body weight. And I'm feeling for that wag underneath my inferior SIF. And from there, I located the patient's right transverse process of T8.
Next, palpate the left ischial tuberosity. Left ischial tuberosity.
So standing between the knee and the ankle on the patient's left side, I'm going to visualize my crosshairs from the midline of the patient's thigh to the gluteal fold. From there, I'm going to move superior, anterior, and medial, SAM, in that direction, and helicopter down to that bony resistance right there. And I've located the patient's left ischial tuberosity.
Okay. Next, locate the left cuboid bone. The patient's left cuboid bone.
And then redrape you. I'm asking you to flip over to your back.
Patient's
Left cuboid bone. Okay. So I'm going to bend your knee here, Stu. Left cuboid bone. So taking the patient's left foot. This one, Stu. Left foot in my hand, holding the lateral aspect of the foot. Holding the medial aspect of the foot. I'm going to trace the 5th metatarsal down to the styloid process. That'll be my landmark. Finding the cuboid bone, I'm just going to travel from that styloid process up medially Feeling for that bony resistance right there. Finding the cuboid bone, I'm going to stabilize the rest of those tarsal bones and move that cuboid bone P to A just like that. Feeling for that very slight motion there.
Okay. Your last structure is the patient's right acromioclavicular joint. So right AC joint.
Sue, if you would sit up for me on the edge of the table. You said right AC joint.
Right AC joint.
Perfect. So just sitting there, Stu. I'm going to drape your robe here again, just off your shoulder. AC joint. So, tracing the clavicle laterally to its articular position there, and also tracing the acromion spine of the scapula to the position where they meet. I'm locating the patient's right AC joint. Using my SIF and IF of my medial hand, here I'm going to grab the patient's right elbow. Feeling that AC joint right here and right here.
So where are your fingers? Where's
My
your
fingers, one finger is on the distal end of the clavicle, and the other finger is on the acromion spine, the
Okay.
distal acromion spine. Feeling for that articular facet right there, that surface. I'm going to bring the patient's arm up into flexion, and what I'm feeling is the acromion moving inferiorly, getting out of the way of the flexing humerus, and feeling that AC joint motion right there with my medial hand.
Okay.
So I've located the patient's right AC joint.